Alright, hi, my name is Nikki Snow. I have lymphoma and sebaceous cysts. It's like a cyst is basically a little sac-like pocket of tissue that contains either fluid, air, or oil. I have oily skin, so I get them, and I have one case that's actually cancerous. I've had 4 surgeries, and I'm planning to have more, and I have one on my arm, which is the lymphoma one, and lymphoma is a non-cancerous growth of fatty tissue that develops under the skin, typically on the arm, the neck, your back, and I have one on my shoulder and one on my arm. And then sebaceous cyst is filled with oil substance called sebum that's filled with hair follicles or oil. So I have 4 on the back of my head, and I've had 4 on my face, and you can get them through genetics. Like my mom's had them, she's had many on her back taken out, and you have a crack on your skull, and I have one right here, and it started affecting my vision because it can actually grow in, and one thing you should never do with them is pop them, because if you pop them, the fluid can get into your blood and just cause various infections. They can form between infections, diseases, blockage in your oil ducts, if you don't wash your skin enough, just simple things that can cause it very easily. Other forms of them, you can get them on your ovaries, you can get them on your breasts, you can get them thyroid, pancreas. Like I've had 2 on my ovaries, and one of them burst, and I thought I was having my appendix explode. It was like extremely painful. And about 20 to 50% of women will get them before they're 50. And this one is on an eye, which is lymphoma. It's like on the skin, and that's what it looks like when it comes out. There's a lot of more vivid, pictures, but I didn't want to show those. The ways you can prevent them is you can put, if you notice some hard bump in your skin, you can put heat compression on it that helps it drain out. Recognizing it is just a little bump. It starts to swell sometimes, they go away, but they usually always come back. This is actually my mom's, and that's the back of her head. And it's about the size of a small Play-Doh. And hers popped recently and got into her blood, and it got infected, and she had to go to the hospital, and they had to do blood work to figure out how they can get it out of her system. This is on the head. It's what mine looked like right up here. But like I said, I had 4 surgeries, and I'm going to show you. That's me getting surgery about 2 months ago. This was right after surgery. I literally took that picture right after. And this was on my car ride home, how bad my face started swelling up. And right here, where it was, is where the crack is in your skull. And that's where it started affecting my vision, and it gave me really bad migraines and headaches, where to the point I just could not stay focused in school or even look. I would just have to close my eyes. It got really bad, and it got swollen, and one actually grew back. Right there, one grew. And I was bruised. I couldn't really do anything for a couple of weeks, but it started getting better. And that's what I looked like with mine, and that's after, how you don't see the creases or the bump anymore. And I was actually very self-conscious about it, because every time I smiled, you could see a large bump in the middle of my head, and if you were to touch my head, you could feel a very large bump there also. But so.